I just got done making a video about sutural versus dentoalveolar expansion. So that might be a really good sort of part one to go back and watch that first before you watch this video. In this video, I'm going to be kind of taking you through a deep dive about clear aligner use for children and some things that so I personally have been a clear aligner provider for adults. I've also myself done Invisalign. And so this is going to share a combination of things. It's going to run through some research to show you why this might still be an effective tool to be used early in children. I'm going to go through some things that I wish I knew before I started Invisalign, or things that I feel like it's really important that any patients know before starting Invisalign. Just any sort of things to consider as both kind of pros and cons for why this might be a good option for treatment. So I know I'm saying Invisalign a lot. I'm actually talking about clear aligners on the whole. We'll talk a little bit about what that difference is here first. So Invisalign is probably the most well-known brand of clear aligners, which is why my default was to use that term. But there's also several other brands that have emerged. ClearCorrect, Candid, Sure Smile, Angel Aligner is actually really big here in Portugal, where I'm living currently. One of the biggest distinctions that I think is a minor detail, but for some people it might matter. When you have something like Invisalign, you have this very precise trimming around where the tooth edge stops and where the gum tissue starts. For some of the other types of aligners, that may not be the case. You have kind of a little bit of a bulkier trimming of those clear aligners. Whether that's something that's worth the difference of kind of the expense or whatnot, that's up to you, but that's something that is a minor detail that can vary from one brand to another. So that's worth talking to your dentist about if that's an important detail for you. I think for someone who is maybe more orally sensitive, already clear aligners are going to be a better option than some alternatives, but that may be something to think about, is the less material, the better for someone who's very orally sensitive. So when it comes to looking at some of the research, I was able to find a few studies that I think shed some good light on why this is still a really good option for kids. I'll be honest, when I first heard that Invisalign was being marketed for use in younger children, so the intended age range of Invisalign first is between age 6 to 11. I was pretty skeptical because I knew how adults can be with Invisalign sometimes, and we'll talk about that more in a moment. But I've been really pleased with the reports I've gotten from providers, the reports I've gotten from patients who've tried it, and also with the research. So here I just wanted to show you that I know a lot of times people talk about in adults that Invisalign use or braces is going to be done by tipping teeth rather than moving the bone, moving the roots and the crown together. What we want to see often is moving everything all at once. So in adults, it's really common to actually hear people say, oh, with braces or Invisalign, this is all being done by tipping. But tipping is just one type of movement. There can actually be movement of both the crown and the root of the tooth at the same time. And the bone can remodel around that in a patient who's younger, who's still growing. So while that's a legitimate concern for adults, in children, these studies were done to look at some of the changes at both the chewing surface of the tooth and at the gum line where the root is positioned. And it was suggesting that this Invisalign first approach can create real expansion, not just tipping of teeth. In another study, I think it's important to kind of understand the limitations of this. They were looking at the amount of expansion that can take place with an approach like this is typically going to be, commonly you can achieve around 3 to 4 millimeters. In a more advanced case, you might be able to get around 4 to 6 millimeters. And then anything more than 6 millimeters is probably a more complex case that's going to either need Invisalign as kind of that phase one, and then a different other device, or vice versa. Maybe you do need to do first an expansion appliance for sutural expansion first, and then go back to see what can be done with Invisalign. So this is just to give you an idea of some of the projected amount of movement that can still be considered expansion with an approach like this. And a systematic review basically runs through a lot of different studies that have been done on Invisalign. They basically found that Invisalign first represents an effective solution for addressing the transverse maxillary deficiency. So basically the width of how the dental arch is, you can improve the width in patients who are still growing. And yeah, I think that's an important takeaway. One of the other things, just one of the last things to point out with how some of the research played out was, of course, there are a variety of different appliances. So when we say a rapid maxillary expander, rapid palatal expander, there's different ways that that looks like. Sometimes it's just metal, sometimes it's metal and it's acrylic, sometimes it's adjusting only the teeth in the back and the teeth in the front. So there's different models and things to think about. But when we're looking at this side-by-side study that was done with this type of expander and Invisalign, by using the clear aligners, they could do more changes to the upper teeth that normally would have had to be a second phase of orthodontics. So that's just one reason to maybe give yourself a little kind of moment of pause to say that Invisalign can offer some things that maybe expansion can't. And I do want to make a note, the Invisalign did come out with a Invisalign palatal expander, and that is different from what I'm talking about here in this presentation, in this topic, this research. I am talking strictly about the use of the clear aligners. And in addition to that, I do want to point out, I know I talked about kind of the normal cases and some of the intermediate cases. Some advanced providers, when it comes to Invisalign, will be able to access some things like mandibular advancement or elastics. So mandibular advancement wasn't a feature when I was providing Invisalign. I've never used it personally, but the way that that works is basically there's kind of like these little extra triangles, one built on the top arch, another built on the bottom, and the way that they are going to close the jaws together, there's an intended sort of interference from this interlocking of the top and bottom triangle, and the bottom jaw has to slide forward. So if you think you've heard about maybe mandibular advancement devices for adults who are snoring, it's kind of the same concept. But if we catch something like this and we can use it in a child who's still growing, then it can be used to influence the growth of the jaw joint and reposition that lower jaw. It's sort of a postural approach to treatment. Elastics, on the other hand, is a more common term. We really just mean those tiny little rubber bands that you may see more commonly thought of to be used with braces. That is something that can be used with Invisalign as well. We had a doctor in the office I used to practice in who was much more advanced than I was with her Invisalign training, and she often incorporated elastics. Now, both of those approaches may be a little harder to adapt to for somebody, again, who's more orally sensitive. If we're choosing Invisalign for someone who has a high gag reflex, or they're just kind of a tricky option, then maybe we don't want to get too fancy. Maybe we just want to start knowing this is phase one. Let's just see what we can get done with the basic approach. But it's good to know that some of these more advanced tools do exist. And these are going to be 8 things that I think it's really important for anyone to know before starting Invisalign. This first one I learned the hard way personally, it's not all easy. Starting it is uncomfortable. So I know the advertisements kind of make it look like it's absolutely no big deal. My mouth and jaws were really sore when I first started Invisalign, and it wasn't enough that, I would ever tell anyone not to do it, but I think it's really important to acknowledge that the first try, maybe even the second try, are a bit uncomfortable. And by the time you get moving, like once you're into maybe the third, fourth try, it is a lot easier because that initial point is where the tooth movement begins. So a certain amount of pressure is applied to send signals to kind of break down the bone so that the tooth can move through the bone. So that is obviously enough pressure to be uncomfortable. So eating is uncomfortable. I found the first try to just like existing was uncomfortable, but then it gets much easier. So one thing that you could consider with that, if needed for a child, kind of taking a longer, most trays now with Invisalign, you only need to leave in for about 1 week at a time. But for a child who's just starting, maybe you want a longer window of time, 2 weeks or 3 weeks, to kind of get used to the first try. And then once you get going more, it's a lot easier to just have good momentum. Another thing that I didn't necessarily appreciate was how it would affect speech. It's obviously a lot less kind of invasive to the mouth space than some alternatives, but it does create a little bit of a lisp. And so that's just kind of an adjustment period. So something to think about, just to know. When it comes to your eating schedule, snacking, and hygiene, the trays are typically left in for about 22 hours a day. You're removing them only to eat. And then after you eat, you do want to brush your teeth before putting them back in so you're not trapping any food debris and creating an increased risk for cavity development. So then, because it's removable, you can get pretty good hygiene. But the eating schedule can be a bit different. I know that for a lot of adults, we would joke a little bit that it was a diet plan because all of a sudden you have to really reconsider, is it worth popping your Invisalign out to have 2 bites of the snack, or are you going to wait until the next meal? That's obviously a big thing. Kids are snackers often. They need a lot more calories. I can almost hardly keep up with my nieces when I go visit and try to keep on their snacking schedule. So it is just something to keep in mind. It is going to be a bit of an adjustment there. Attachments, for those who don't know, that is going to be tooth colored filling material that is placed on some of the teeth. This is dependent on the plan that's being used, the movement that's required for each case, but that is something where it's important to note beyond just the clear trays that you're putting in the mouth, sometimes there are these attachments put on the teeth. They're temporary during treatment, and at the end of treatment, they're removed. So it's just something that it's important to understand. IPR stands for interproximal reduction. Hopefully no one's using IPR on children, but this is a method that initially was and is still used in adults often. What it means is there's sort of a little like sandpaper that's used to shave down a little bit of tooth structure in order to allow the tooth to move in a different position a little bit more easily. So the reason why this kind of calls attention to me is because I actually went through a second round of Invisalign training from Dr. Ben Moralia, who is now deeply involved with Tooth Pillow and things like that. But he taught when we as the provider send sort of our prescription into Invisalign, you can say, I want this to be an expansion case only, no IPR. And so that's something to consider. We really want to be expanding out in this growth phase. We're not trying to bring anything back in. The goal isn't at this point in time to get the teeth perfectly lined up. We're doing this much more so that the jaws can be in a better position, the teeth can be in a better position for function and whatnot. Refinements are an important talking point because I think that, with any orthodontic plan, the end point is determined when you get there, right? But with something like Invisalign, because you're receiving a set plan that's maybe or 20 aligners, you're starting it with the first tray and you have this kind of mental timeline of like, okay, when we get to 20, we're done. And what can happen is if something's not fitting right or tracking right along the way, or if the plan needs to change a little bit, or you get all the way to 20 and you're not exactly where you projected you would be, then there's something called a refinement that just adds, you take new scans, new impressions, create a new prescription, and you get kind of like an additional round of treatment. So again, to me, this is just something to be aware of is don't mentally commit to like, okay, we're starting this and this is the number of trays exactly that we need. Retainers is something to talk to your provider about. In adults, it is something where you finish Invisalign and you get a retainer that's intended to be worn for the rest of your life. There's a lot of talk now, again, around myofunctional therapy and trying to get natural retention from the balance of the muscles in and around the mouth. In a growing child, you might finish Invisalign and you might do something like a tooth pillow or a habit corrector. You might have a different retainer that you wear for 6 months and then you stop. So it's just something that I think is a conversation to have with your provider to make sure that you understand, with this typically being phase 1 or an earlier phase of treatment, how are we going to support ongoing growth without losing the progress that we have? And then the last thing to mention is a posterior open bite. So sometimes during the course of wearing Invisalign, you have 2 layers of plastic between your teeth and the way that the teeth come together. So what can happen is when the jaws are closed, the teeth are in contact without the aligners in, versus with the aligners in, there can be a little bit of space. A mixed dentition or a child who's still growing, there's constantly going to be changes of the bite all the time anyway. But this is something that shouldn't necessarily be causing alarm. It is just something that we need to look at, like realistically, is any kind of space that's there expected to close when we stop wearing the aligners? Or is it naturally going to settle over time? Or is this something that is still caused by some sort of interference? Some of the benefits of Invisalign, again, with it being removable, it is a pretty hygienic option outside of the risk of kind of closing in any food particles that may not be brushed away from the tooth surface. But it's removable, you can do your normal hygiene and then pop them back in. It also provides some breaks for the body. So that's something that some parents are concerned about is the force that's being applied. While braces or Invisalign apply much less force than any of the kind of sturdier expander options, it is still nice to allow for, having that break built in. And it's less visible for those who care about that. It can be easier to adjust to and to tolerate. Again, it's not really taking up much tongue space at all compared to some of the alternatives. The tongue, speaking of that, like you can access the roof of the mouth. So things like myofunctional therapy can actually still take place while you're doing something like Invisalign. Some providers don't feel that that's the case when expanders are in place. And again, I already spoke about that. It can be more gentle compared to some of the more rapid palatal expanders. And then realistically, one good thing is that there's few, if any, emergencies with something like Invisalign. I'm really strapped to find any examples where something was an emergency. You might have a button pop off. That's not typically an emergency. Trays may not be fitting quite as well. None of this, like all of it certainly warrants going back and talking to your provider, but it's rarely a true emergency. Whereas with some of the other alternatives, if something kind of pops out of place, it can be more of a concern that you don't want to wait to get checked out with some of the alternative treatments. I know like a classic example of that is like a wire is poking something it shouldn't be and it's uncomfortable, you know. So then just a few more kind of words of warning to consider is the severity of the case. I talked about that with anything that is needing more than 6 millimeters of expansion. Maybe Invisalign or a clear aligner approach isn't going to be enough. Maybe it's a good place to start, but we know it's going to be in combination with something else. Or maybe it's not where you want to start. Compliance. So while the fact that it's removable is a pro or advantage in a lot of cases, it can also be a con because if you have a child who's really strong-willed and they've made up their mind that they don't want to wear it, they know that they can take it out. So that's something to think about is like, do you think that this is something your child's going to cooperate with? Sometimes I do see families who are expressing remorse from choosing removable versus fixed options because the fixed is kind of forced upon the kid. They can't take it out. It's there. Whereas removable is going to require more cooperation. And one other thing, which again, to me, it's not necessarily a reason why someone maybe wouldn't pursue this, but it can be offered by any sort of providers who don't necessarily understand airway. Although I do think if they're offering Invisalign First, which again is intended for ages 6 to 11, they're appreciating the importance of early intervention. So they're probably still trying to approach this in setting up a good foundation for this child. It's just something to know about, talk about if that's important to you. And just making sure that you and your provider are aligned with what the goals are. And then really kind of the only contraindications that we have for something like clear aligner treatment is going to be either active gum disease, periodontal disease, or active temporomandibular disorder. So if you have somebody who has inflammation going on in their body, like we don't need to be jumping into this treatment. You need to stabilize that inflammation first, stabilize the symptoms first, and then you can consider something like Invisalign or clear aligners. And that is all I had for you. Hopefully that helps shed some light on the option of clear aligner therapy for our younger individuals.